Hello everyone, it's Dr. Tidman. Thanks for stopping by. So what about weight loss? Have you ever said, I can't lose weight, or I have too much weight to lose? Or what are my options for losing weight? I'm so confused between bariatric surgery or medications, or should I just work out at the gym more? I hope to answer these questions in today's video. I'll be discussing an article by Volek and his colleagues that talked about the options for weight loss and some of the pros and cons of each. So keep in mind that information on my videos is just for education. Consult your medical team if you want to make any changes in your medications. Today I'm going to be discussing a little bit of some of the history of the treatments that we use for obesity and some of the nutritional approaches. I'll talk about the article by Volek and his colleagues and some of the elements that they reviewed and researched in their article. I'll discuss the author's conclusions and then, of course, always Dr. Tidman's tips and takeaways at the end. So stick with me. Remember to subscribe to my channel and hit the notifications so that you'll be informed of future videos that I post. So the article by Volek and his colleagues is entitled Nutritional Considerations During Major Weight Loss Therapy. Focus on optimal protein and a low carbohydrate dietary pattern. So the authors point out that 4 out of 10 adults are now classified as obese, meaning that their BMI is above 30. An additional 1/3 of adults in the U.S. are overweight, which means their BMI is between 25 and 30. There are common treatments that are used in obesity medicine. These include bariatric surgery, very low carbohydrate ketogenic diets, low fat diets, vegetarian diets, and of course the new GLP-1 medications. Each of these approaches does show promising results, but we also have to remember the negative effects of some of these interventions. All of these interventions require proper attention to the nutrition so that you can avoid deficiencies. So the authors investigated research articles that covered a lot of these interventions for a variety of health conditions, not just obesity. But the overriding theme of their article was discussing weight loss, and the history of weight loss research has really been full of low fat, low saturated fat, high carbohydrate, vegetarian approaches for many years. The problem is currently the population in the U.S. has a problem with excess fat accumulation, which leads to or exists in combination with other metabolic health conditions. We now have greater access for our patients for treatments like bariatric surgery and GLP-1 medications that can produce some substantial weight loss, but they also come with concerns about significant loss of lean muscle mass and some nutritional deficiencies. The authors investigated the importance of adequate protein intake to maintain your lean mass. The research evidence that supports low carbohydrate ketogenic diet patterns has the potential to really influence obesity management in the U.S., but has the need to be conducted in combination with exercise and adequate protein intake. The authors examine the evidence of nutrition required to maintain muscle mass. And we know that maintaining muscle mass is critical for maintaining health, longevity, and independence. So the authors focused on determining the optimal quantity and quality of protein to be used to maximize lean tissue, strength, and health. The unique role of low carbohydrate ketogenic patterns, especially on the maintenance of lean tissue, but also addressing visceral adipose tissue, that is the fat that accumulates around your waist. The role of exercise, including resistance training, is something that the authors focused on in their review. So again, common treatments for obesity management include bariatric surgery, which has some positives. It's generally safe. It improves other conditions like diabetes, and it produces substantial weight loss. But unfortunately, this weight loss can be short term if you don't address the root causes of the obesity. Some of the complications with bariatric surgery include leaks in the anastomosis, or when they bring the intestines together, stenosis, or when the intestines will actually close off after surgery, requiring more surgery, internal bleeding. Gastric reflux is often a complication after bariatric surgery. Blood clots can also occur. And then complications that occur down the road, including erosion of the bands that are used, like in gastric banding procedures, intestinal obstructions, gallstones, something called dumping syndrome, where everything you eat goes right through you and is not absorbed. Ischemia, which means a loss of blood to certain parts of your intestine. Anemia, loss of adequate calcium absorption. Kidney stones, osteoporosis, and that's because of absorption problems as well. The other problem with bariatric surgery is, to qualify, you have to have a BMI of above 40 without accompanying other diseases or conditions, or above 35 with accompanying conditions. And some of these can be hypertension, type 2 diabetes. Those are the most common. So there are some limitations as to who qualifies for bariatric surgery. Medications. This is a hot topic in health today, and I'll bet you see a lot of advertisements on your Facebook feeds and your other social media about these GLP-1 receptor agonists. These are injections commonly called Wegovy, Ozempic, and Zepbound. Each of these has a different effect. Some of the positives are, yes, you experience significant weight loss, and pretty rapidly. These medications can reduce the symptoms associated with type 2 diabetes and can help you control your blood sugar in some cases. They give you a lot of appetite control. And in some people that have eating disorders, especially the Zepbound, can reduce what we call food noise. That is a preoccupation with food. Of course, some of the complications of these medications include weight regain once you stop the medication, and the regain is rapid, and you often regain a lot more weight than you lost. Chronic nausea and vomiting. It almost induces a type of anorexia. You don't want to eat because you're too nauseous to eat. It affects your gut motility. That is the action of your intestine moving food through your intestinal system. It's actually reduced using these medications, which can lead to significant constipation. Loss of lean muscle mass, which you may not recover, is one of the major concerns of these medications. And also, use of these medications once again does not address the root causes of the obesity in the first place. Exercise. Can you lose weight with exercise? Well, some people can, but it's not commonly something that's very effective for weight loss. There are other benefits to exercise for sure. Benefits to resistance training to improve muscle mass, has other cardiovascular benefits, can improve your balance and mobility, improves your flexibility and endurance. But as the authors, Volek and his colleagues, point out, exercise alone does not really lead to weight loss. And it can actually increase your hunger, your appetite, and your cravings. Diet. Well, sure, dietary interventions have been used for weight loss for many, many decades. The right diet, which is individual for everyone, has some positive short-term weight loss benefits. Of course, you see other health benefits with dietary interventions, but it, again, doesn't really address the root causes of obesity and type 2 diabetes unless you find the right diet for you, for your body and what it needs. Some negatives about dietary approaches are there's really no consensus in the research on which approach is the best. Some say low fat is the best, high carbohydrates. Some say high fat, low carb is the best. Some say vegetarian or vegan diets are the best. Some say Mediterranean diets are the best. It's so confusing. But we know that in the research, emphasis on low-fat dietary strategies has not been successful. Another problem is dietary studies are very short and they're observational. We really need more randomized controlled clinical trials on some of these dietary interventions. So the low carbohydrate diets appear to be especially superior to low fat diets when it comes to individuals who are insulin resistant. And you'll remember from some of my other videos on my channel that insulin resistance is where your insulin stays high in order to control your blood glucose for a long period of time. And then eventually your cells in your body stop responding to the insulin and your glucose becomes very high. Insulin is a fat storage hormone. So the higher your insulin, the more your fat storage will be. When you have analyses of the research like the authors did of long-term weight loss trials, most of them are low-fat trials, and they really don't show much benefit. Some of the negatives about low-carb ketogenic approaches is dietary compliance for some people can be really difficult. It's really hard to give up those foods, especially those foods that you enjoy socially. Some of the social pressures are very overwhelming. And we need more long-term studies. So what about diet plus exercise? The authors concluded that this is probably the best combination for sustained weight loss. They cited studies that have used dietary interventions before and after bariatric surgery and found superior effects. They also found superior effects in the research of using a low-carb ketogenic dietary strategy before bariatric surgery and then after bariatric surgery, with much better effects than even the Mediterranean diet. They also have used ketogenic approaches after bariatric surgery to help people sustain their weight loss, which is a real problem in bariatric surgery. Their key to success revealed that adequate protein seems to be the most important thing for sustainable weight loss while improving your muscle mass, along with your exercise regimen. They recommended from their review that meals that provide 25 to 30 grams of high bioavailable protein sources are very beneficial. In the article, the authors explained in depth about ketone metabolism and the role of nutritional ketosis in weight loss. And you've heard me talk about ketones a lot on my channel. We use ketones in Parkinson's disease and in a lot of metabolic health conditions. But now they're saying that ketones can play a big role in weight loss. So that's a new finding. They also review the use of the ketogenic diet and nutritional ketosis in other conditions. They cover non-alcoholic fatty liver disease, type 2 diabetes, epilepsy, Alzheimer's, Parkinson's, multiple sclerosis, traumatic brain injury, rheumatoid arthritis, spinal cord injury, new research in heart failure, chronic kidney disease, women's reproductive health, and I have a video on my channel about PCOS, so check that out, and mental health disorders. They discuss the benefits of endurance training, resistance training, along with the ketogenic diet approach for sustained weight loss. Their conclusions are adopting a personalized, well-formulated low-carbohydrate diet that has adequate protein between 1.2 and 2 grams per kilogram of reference weight, maintain a beneficial state of what they termed euketonemia, which is circulating ketones between 0.5 and 5 millimolars. How are you going to know about that? I'll tell you in a minute. They find that maintaining ketosis is a promising approach for many individuals with obesity for sustainable weight loss. This addresses a lot of the root causes of obesity, which we feel in metabolic health is insulin resistance. So their bottom line in their article by Volek and his colleagues: low carbohydrate dietary patterns that contain moderate protein, that's between 1.2 and 2 grams per kilogram of reference weight, from high quality food sources are effective for promoting meaningful decreases in excess weight without the loss of muscle mass. Sounds a lot like Dr. Tidman's tips and takeaways, doesn't it? You know these if you've been following my channel. I hope that by repeating them, you're beginning to really understand how to use them in your daily life. So reduce those carbohydrates and sugars to really help your insulin resistance. Take those carbs down to below 20 grams of total carbs per day. Keep your protein at a moderate level, especially if your goal is to maintain muscle mass or maybe improve muscle mass. And certainly if you're doing some resistance training along with your diet. Adopt the ketogenic diet, keeping your glucose levels below 100 milligrams per liter. Obtain a blood glucose and ketone meter so you know what your glucose and ketones are doing. Increase your daily intake of healthy fats to increase those ketones, and you know what those are if you've watched me before. Butter, lard, tallow, olive oil, coconut oil, all of these are good. Take out all the processed foods sugary drinks like sodas, and other inflammatory substances like grains. Your body doesn't need them. Begin a daily exercise regimen that includes aerobics, 2 days a week, 3 days a week, resistance training, 2 or 3 days a week. Those of you that are older, in your 50s or above, can also include some high impact training to maintain your bone health. Be sure to check out my channel and the bone health video. Institute some intermittent fasting, 2 meals a day, 16 hours of fasting overnight, or 1 meal a day, according to what your glucose levels are showing you. Thank you so much for stopping by to see this research review on the Volek et al. Article about nutrition and strategies for weight loss and maintenance of muscle mass. I hope this has been really helpful. Be sure to make a comment below. Let me know if this was useful information for you. And be sure to check out my other videos on my channel and subscribe to my channel so you know when I'm posting them. So take care, everyone, and I'll see you in the next video.